I introduced the Advancing Maternal Health Equity Act, which is under the Medicaid Act, and it incentivizes states to increase their spending on maternal health services under Medicaid by raising the federal reimbursement rates for states. That means it's money that the federal government will match, not money that has to come from their existing budgets. This is money coming to the states from federal governments to literally save lives. And it's not just impacting Black mamas or Black babies, but this is an American issue that is uniquely American because Black women are dying here at higher rates than in third world countries. And these are policy decisions. And that's why the Momnibus Act is so important, because policy decisions got us here and policy decisions can help us address this cause.
You know, it's something that you bring in preeclampsia, because I also developed preeclampsia after the birth of my twins. And it's one of those things that it really shakes you to know that 1 in 5 women die from pregnancy-related complications across this globe. And we, the two of us, if it had not been for medical intervention, would have been one of those two, women. And it's incredibly disturbing then when you hear senators like the one in Louisiana who said, well, if we just remove Black women from the equation, our maternal mortality really isn't that bad.
As
right?
if we're not a part of the entire American tapestry. Like, exactly. We are American. So you don't just erase us and remove us. You address the problems and the root cause. And so that's why these conversations are so important, and bringing out the real stories. So there's not just a number saying remove the Black women. I like to bring stories like Adriana Smith, who lived in Georgia, and Amber Nicole Thurman, who literally died trying to give birth to their babies. Right. These are real stories, real women, real lives that have been impacted.
And I guess the question is for both of you. There's obvious racial disparities that impact Black and brown people, Black and brown women more, right? 3 to 4 times more likely to die. In certain areas, you're 12 times more likely to die in DC. And the question is why? Why do you think? What's the root cause? Is it socioeconomic factors? What are the variables do you think are playing into why mothers are not going home with their babies?
So this is something that I worked on before coming to Congress at the county level. And I want to remind the folks that are watching, it was one of the catalysts for the legislation that was introduced at the county level was what happened with George Floyd. Prior to George Floyd, we had the pandemic that started. So everybody was locked in their homes. They had nothing to do other than to watch TV. And we started seeing the statistics happen right before our eyes of Black people having more negative impacts as it related to COVID. Then we saw what happened with the tragic killing of George Floyd. And so it was an optimum opportunity for us to introduce legislation to declare racism as a public health crisis. Now, we have been doing this work in October of 19, but 2020 was the catalyst for all these things that started to happen right before America's eyes, where they could not look away. They could not deny that Black people were dying at more aggressive rates than our white counterparts. They could not look away at the brutal killing of Breonna Taylor and George Floyd. So racism is a factor in what is happening to us as it relates to our infant and maternal mortality. It is the history of slavery and the stress that we carry in our bodies that makes it difficult for us to carry pregnancies to full term. So it's not socioeconomics. It is not education. It is not even your zip code. It is a genetic predisposed condition that we have as Black women that has been passed down from generation to generation due to how we've been treated in this country. And so, people want to, come up with all of these things, but it is a comprehensive, holistic approach that has to be taken in order to address this issue effectively. And so when we took it on at the county level, we introduced components that had metrics that could measure transportation issues, housing issues, socioeconomic issues, because it's all encompassing. It's not one thing or a silver bullet that we can fix. And that's why you raising this issue is so critically important. And I thank you again for doing it.
Yeah. Many people say that location does matter. I heard you state it doesn't, right? Ohio has the same issues and Georgia has the same issues in South Carolina. And where you live, though, actually does matter, particularly in South Carolina. That's where I'm from, if you can't tell by the accent. But literally half of our counties don't even have a hospital. They don't have a OBGYN in the hospital to give access to persons who are literally carrying the next generation to life. And so,
if I may, I just want to clarify. Yes, the access to resources matters. That certainly matters. And that does play a role. But I don't want people to think like if I move into a suburb or, a wealthier community, yes, access is going to be important. But this is something that is specific to us and our bodies is what I meant. But you are absolutely right. Our zip codes can dictate the outcome of our health in so many disparate ways. So yes, but I hope that clarifies my comments.
Oh yeah, for sure. And and you bring up a very important part. What we know is that 80% of all pregnancy related deaths are actually preventable, right? That you can have access, you can be in the hospital and still you can have, unfortunately, deaths. So what do you think we can do? What can be done either through legislation to either improve access, to improve training, to have accountability? What is it that you think is the missing piece in this puzzle?
I mean, I think it's a combination of things. We have to improve access. We have to make sure that doctors are actually listening to patients, because we know that Black women and our concerns are ignored when it comes to many doctors. And we're not always taken seriously when we're talking about the issues that we face. And that's why we have to invest in things like a portion of the omnibus is the Maternal Education Investment Act, which would create grant programs for maternal and fetal medicine training and residency and fellowship programs for the integration of maternal training into primary care. Because just like in South Carolina, over half of the counties in Georgia don't have an OBGYN. I will always remember Dr. Kenzel, who is down in Southwest Georgia, and she was literally providing services in a Tasty Freeze building just so that women could get access to care. She wasn't an OBGYN. I remember being pregnant with my Carter, and I saw a perinatologist every single week at the end of my pregnancy. Someone in rural Georgia doesn't have access to a perinatologist. And so making sure that if you're going in for that primary care, how can you also have someone trained to at least get you some baseline care so that women are not facing these dire health outcomes? And so there's a number of things that it's going to take to address this. And we've got a lot of work to do. But that's why I'm so glad to have a co-conspirator for justice like my sister in service, Chantel Brown, who is working on this issue, and people like you who are practitioners bringing this up and making sure that it's not just on the back burner. And we're continuing to highlight the needs and what women are still facing today. In 2026, we're still facing these health outcomes that seem like something from a day past.
Right. And that day pass, our statistics are matching pre-Civil War numbers when it comes to Black women and their maternity and mortality. So what can voters do? You two are in great positions of power, and in the hospital, I'm in a great position of power. And oftentimes it leaves the person feeling, what can I do? Right. So what can voters do to ensure legislation gets passed to improve maternal health care? Is there anything they can use besides their vote?
Absolutely. They can call our offices. They can call their senators. I know my sister is a lot like me. Well, she's very blessed right now. She has two senators that will actually listen. I am in the great state of Ohio, where our senators need a little bit more encouragement. So I would encourage you to contact them, to share this information far and wide with your friends, your neighbors, your family, so we can talk about it and so that people can be more aware. I think the fact that we have the ability to share the information, but we sometimes are shy about speaking up. We have to stay informed and we have to speak up. That is how we address these challenges. If you are in a position where you are actually experiencing some of these disparities or experiencing some of these issues as it relates to the care that you're getting, get a second opinion if your provider is not, if you don't feel like you're being heard by your provider, if you have the privilege to do so. But it also, I would be remiss if I did not remind folks, it is a direct impact of the big ugly law that was passed last summer, how these programs are being dismantled in HHS and having cuts to things that DEI programs where we may have had advocates on our behalf. So we have to be our own advocates and ambassadors in these spaces and support each other so that we can push back on the policies that are creating harm and continue to remind people to stay civically engaged so that, as Nakima said, as Congresswoman Williams said, that we can get policies back on the books to reverse course of the policies that are doing harm to us.